and start with all of the cranial nerves. So the first one that we're going to test is the olfactory nerve, and that's cranial nerve number 1. I'm going to have you close your eyes and smell 2 different objects, and you let me know the difference between them and what you smell.
Lavender
Yes.
and alcohol.
Yes. So cranial nerve number 1 is intact, and we've already we've already tested the optic nerve, which is cranial nerve number 2, with the smell and eye chart, and your vision was 20/20 bilaterally. Now we're going to test your oculomotor nerve, and it's cranial nerve number 3. So I'm going to shine the light in your eye. Okay, and it was a 4 millimeter to 2 millimeter. Bilaterally, it was 4 to 2. Okay, and now we're going to test 3, 4, and 6, which is oculomotor, trochlear, and abducens, and we're going to do that by, what do you think? Okay, I'm testing your cardinal fields of gaze, so I'm going to go to the middle, and don't move your head, just look at the light with your eyes. Okay, the cardinal fields of gaze are intact, so 3, 4, and 6 are also intact. Now we're going to test your trigeminal nerve. That's cranial nerve number 5. I'm going to have you close your eyes and let me know when you feel any sensation on your scalp or face.
Yes. 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 Yes.
Okay, and now I'm going to assess your chewing. Can you act like you're chewing gum for me? Okay, so cranial nerve number 5 is intact. And like I said, that's the trigeminal. We already did 6 with the cardinal fields of gaze, so we're going to move on to number 7, and that is your facial nerve. I'm going to have you close your eyes tightly, smile, and frown. Okay, cranial nerve number 7 is intact, and I'm going to look at your saliva, and it is adequate. So once again, cranial nerve number 7 is intact. Cranial nerve number 8 is vestibular cochlear. We're going to test that by the whisper test. I'm going to have you distract one ear by pushing down on the tragus. I'm going to whisper a word to you.
69.
Okay, and I'm going to do the other ear now. Can you distract that one?
Yeah, sorry. Baseball.
Okay, so cranial nerve number 8, vestibular cochlear, is intact. Cranial nerve number 9 is the Glossopharyngeal, and I'm going to verbalize a gag reflex because I'm not going to choke you. Cranial nerve number 9 and 10, the Glossopharyngeal and vagus. Can you look up and swallow for me? Okay, so cranial nerve number 9 and 10, the Glossopharyngeal and vagus, are intact. Almost done. Cranial nerve number 11 is the accessory. I'm going to have you shrug against resistance. Okay, and that is intact. And lastly, cranial nerve number 12 is the hypoglossal. I'm going to have you stick out your tongue. And I'm not noticing any movements or gesticulations. Okay, now we're going to inspect your head and your face. I noticed just looking at you that your head is normocephalic and it sits appropriately on your shoulders. I'm going to inspect your hair and then palpate it. Okay. I notice that your hair is evenly in distribution and placed. I'm not noticing any nits, scaling, inhabitants, lesions, or thickening of the scalp. Now I'm going to palpate for masses or nodules. Do you feel any tenderness?
No.
No? Okay. So I didn't notice any masses or nodules. I'm going to palpate your frontal and maxillary sinuses. So I'm going to touch your face. Let me know if you feel any tenderness. Nope, no tenderness. Okay, and your facial features are symmetric. Now I'm going to test your oropharynx. I'm going to change my gloves. How are you today? How are the kids?
Sick, actually.
Sick again. You can't catch a break, can
No. And I'm a little snotty today.
you? A little snotty today, that's okay. Okay, the first thing I'm going to inspect is your lips, and they are pink and moist without any lesions or inflammations. I'm going to look at your gums. Also pink and moist without lesions or inflammation. No, sorry, your mouth's going to be open for a while. I'm going to check your buccal mucosa. And that is pink and moist, also without any abnormalities. Can you stick your tongue out? Okay, it's also pink and moist. I don't notice any nodules, not modules, we're not doing shadow though. nodules at this time. Your teeth have dental braces. Are they giving you any problems?
No.
Okay, can you open your mouth again? Sorry. I'm not noticing any dental caries or malocclusions. I'm gonna look at your tonsils now. Okay, they are a 2+. Your uvula, tonsils, and pharynx are all pink and moist without any inflammation or lesions. Now we're gonna move on to your nose. Just looking at it, it sits appropriately on your face and there's no lesions or inflammation. I'm gonna look up. There's a little bit of drainage, exudate, but there's no septal deviation or lesions noted. Now we're going to move on to your eyes. Just looking at your external eye, there's no drooping, discolorations, lesions, anything of that nature. Your conjunctiva is clear without swelling. Your sclera is white bilaterally, and your pupils and irises are round, flat, and with no discolorations. Your eyelashes are evenly placed and distributed. I'm going to palpate your lacrimal ducts. Do you feel any swelling or do you feel any tenderness? Okay, I don't notice any swelling or drainage there. I'm going to move on to your external ears. Before I do that, I am going to go back to the oropharynx and assess the hard and soft palate. Okay, can you look up for me? Okay, it is white with transverse rugate, and then that you turn up. And that is pink and smooth without any inflammation. Now I'm going to inspect the external ear, and they are sitting appropriately on your head. They are symmetrical. Upon inspection, I don't notice any lesions, inflammation, or discoloration on either of them, so they're good bilaterally. I'm going to palpate. Sorry, my hands are full. Do you feel any tenderness? Nope. I'm not feeling any masses or nodules. Any tenderness on this one? Nope. Okay, no masses or nodules there. And now I'm going to check your external ear. I'm not noticing any drainage or swelling. Bilaterally, I'm not noticing any. Now we're going to move to your neck. I am first going to ask you to do range of motion. So can you look up, look down, side, side, and then all the way around. Okay, and now just inspecting your accessory muscles, I notice that they are symmetrical. I am going to palpate them though. Let me know if you feel any tenderness. Okay, no tenderness noted. I'm going to auscultate your carotid. Okay, I'm going to do that for 1 minute on each side. Okay, and I don't hear any bruise. Now I'm going to palpate it one at a time for 1 minute. Okay, and the last thing I'm going to do is name the lymph nodes. So I'm going to start with preauricular, postauricular, occipital, segmental, submandibular, tonsil, posterior cervical, superficial cervical, deep cervical chain, and supraclavicular.
Okay. Now I'm going to have you clench. Okay, let go. And then open, close. And then you do your jaw side to side. Okay, there's a little bit of popping there. Any pain with that?
No pain.
Okay, nice. Next I'm going to move down to your neck. I'm going to just take a look at your lymph nodes. So you have your preauricular. If you have any pain, tenderness, you can tell me.
Okay.
Postauricular, occipital, tonsillar, submandibular, submental. Maybe your superficial cervical chain, posterior cervical chain, and then deep cervical chain, and then your supraclavicular.
No pain.
Beautiful. Okay, next I'm just going to have you sit straight up, maybe put your head back. I'm just going to look at your neck, look at your trachea. Okay. Any pain, tenderness?
Nope.
Okay, I'm just gonna palpate your carotids. Okay, I'm gonna take a listen. Just when I place my stethoscope, if you could just hold your breath for 1 second. Not until I place my stethoscope. Okay, hold. Go ahead and breathe. Hold. Okay, go ahead and breathe. Okay, next I'm going to take a look at your thyroid, which I can't see. I'm just going to come around behind you and hold your thyroid, just palpate it. Okay, can you swallow for me? Beautiful. Okay, and then I'm going to test cranial nerve 11. I'm just going to have you shrug your shoulders against resistance. Beautiful. And then turn your, don't let me push your head. Okay, and then the other way, don't let me push your head. Okay, wonderful. Now we're going to move down to the back. So, I'm just going to inspect your back. Beautiful.
Oh, hands are cold.
Can you turn a little that way?
This way?
Yeah. Well, like with your legs too.
Do you want me to stand up?
Yeah, you can stand up. Okay. Now we're just going to have... I'm going to place my hands back here. Just take a nice deep breath in, okay? Beautiful. And then I'm going to assess for tactile phragmitis. I'm just going to have you say, when I place my hands down, the number 99.
99. 99.
Sorry.
99. 99.
Okay. Next, I'm going to percuss your back. So just a little tapping. You can let me know if you feel any pain or anything.
Okay.
Relax your arms, please.
Hands are cold.
Sorry. And then next, check for kidney tenderness. Just let me know if this hurts, okay?
It's cold. No pain. No pain.
Okay, and then you can sit, and I'm just going to take a listen to you. Put this on you. Okay. Nice deep breaths. If you need to take a break, you just let me know.
Okay.
Okay, just sliding your bra around. Up and under. Okay, now we're going to go to the front. Just take a look. Pretty much the same thing's going to happen on the front. Take a look. Everything looks good. No accessory muscles. All right, take a nice deep breath in. Beautiful. Okay. Now I'm just going to percuss again. A little rapid tap. Sorry.
Cold.
And then I'm going to take a listen again too. So just nice deep breaths again. If you need a break, you just let me know.
Okay.
Sorry. I'll listen to your lateral sides.
Oh my gosh, your hands are so cold.
Sorry. Okay. Now I'm just going to test the diameter of your chest. So then my hand's going to be cold. Sorry. Okay. Beautiful.
No wide load.
It's normal. Anyway, now we're gonna check out your cardiac. So I'm just gonna look at your neck. I'm just gonna have you lay back so I can check your neck distension. Go ahead. Okay. All right, you may sit forward. We'll have you lay back in a second too.
Okay.
Look at your chest. I'm just gonna palpate now for any heaves, thrills, or bruise. So my hands are gonna be cold too. Okay. Sorry, I'm just gonna be under your breast tissue here. I'm sorry. And on the side. Okay. Now I'm gonna take a listen to your heart sounds.
Okay.
Start with the bell. Listen to your pulmonic, aortic. And then I'm gonna be under your bra. Tricuspid. And mitral.
Probably say that louder.
Mitral. And then now I'm gonna have you lie back and I'm gonna listen to you like that. Okay. Your pulmonic, aortic, tricuspid, and your mitral. And then I'm just gonna have you actually turn on your side and I'm gonna do the same thing. And then you can like put your arm over your head. There you go. Okay, wonderful. Now I'm just gonna take a look at your abdomen. So while you're
lay down or?
Yeah, while you're down there, we'll just do this and I'll drape you. Okay. Are you having any pain or tenderness?
In my stomach?
Yeah,
No.
right now, currently. Okay. So I'm just gonna look at the contour, your stomach. Okay. Alright. Next, I'm just gonna listen to you.
Okay. Might hear some gurgling.
Just relax, breathe normal. Okay, I'm just gonna listen over your liver. Your abdominal aorta, which is a little bit above your belly button. Okay, and your iliac arteries. I'm going to take a listen to your femoral arteries, so I have to go under your shorts. Okay. Next, I'm just going to be doing the tapping again for crossing. Yeah. Still no pain or tenderness?
Nope.
Okay, I have to mark you because I'm going to measure your liver. Okay.
You can tell me this is part of it.
Alright, you're going to start down here and just jump up. There we go. Barely even marked you. Now we're going to start from the upper. Down. Barely even see. Now I'm going to measure it.
How long should it be?
4 to 6. Perfect. 4 centimeters. Okay. Next, I'm just going to be palpating. First, it's going to be some light, and then we're going to do some deep pushes. So if there's any pain, you just let me know.
No pain.
Yes. Okay, I'm just going to palpate over your liver. Make sure it's not engorged, enlarged. Your spleen. Okay, and your abdominal aorta. Okay, and I'm just going to feel for your femoral pulses. And then if you want to just sit forward, I'm just going to inspect your flank area.
I'm going to get you to tell me what smell you smell. Ready?
Vanilla.
Good. Okay, keep your eyes closed and occlude the other nostril for me.
Cinnamon.
Good. Okay, you can open your eyes. The second nerve we're going to test is the optic nerve. In a clinic, we would have a Snellen chart to test your eyesight, but today we're going to use your peripheral vision. So if you'll just look straight at me and tell me whenever you see my fingers.
Okay.
Good. Now we're going to check your eye reflexes. So I'm going to shine the pen light in your eye and look for pupil dilation. Good. So the third, fourth, and sixth cranial nerves are tested together. That's the oculomotor, the trochlear, and the abducens. So I'm going to check your 6 cardinal fields of gaze. So if you'll just look straight at me, follow my finger with just your eyes, not your head, okay? Good. Okay. So the fifth cranial nerve is the trigeminal nerve. So I'm going to get you to clench your jaw for me. Good. And I'm going to get you to rotate your head into my palm to resist. There we go. And do the other side. Good. Okay. So the seventh cranial nerve is the facial nerve. So I'm going to get you to raise your eyebrows for me, and I'm looking for symmetry. I'm going to get you to smile. Can you frown for me? And puff out your cheeks. Good. The eighth cranial nerve is the vestibular cochlear nerve. So I'm going to get the tuning fork, and I'm going to place it over the top of your head. You're going to tell me if you feel the vibration in both sides of your ears.
Yes.
It feels equal on both sides?
Yes.
Okay. Now we're going to check behind your ear on your mandible, and you're going to tell me when you feel the vibration stop.
Okay. Okay.
Now, the ninth and the 10th cranial nerves are tested together, and that's the Glossopharyngeal and the vagus nerve. So I'm going to use my tongue depressor, and I want you to open your mouth and say ah for me, and we're going to check your gag reflex. Okay. Now I want you to just relax your tongue. I'm going to lift it. I'm going to put it down and move it from side to side. Good. The 11th cranial nerve is the spinal accessory nerve. So I'm going to place my hands on your shoulder, and I want you to resist. I want you to push up for me. Good. And then the last cranial nerve is the hypoglossal nerve. So I need you to stick your tongue out for me, and I'm looking for symmetry. Very good. Now we're going to move on to cerebellar functions. So if you will, place your hands palm up on your legs, and then rotate them over rapid motion. Very good. Now if you can take the heel of your right foot and slide it from your knee down to your foot across your shin. Very good. And do the same thing for the other side. Great. Now we're going to test for sensory. So we're going to test these trigeminal nerve first, and then we're going to move down toward your body. So the first one, you're going to close your eyes, and you're going to tell me if you feel soft, dull, or sharp. Soft, dull, or sharp?
Dull. Dull. Dull.
Okay. Soft, dull, or sharp?
Short. Short. Short.
Good. Now we're going to move on to your arm. So you'll tell me if you feel soft, dull, or sharp.
Soft. 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 Soft.
Good. Soft, dull, or sharp?
Dull. 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 Dull.
Okay. Soft, dull, or sharp?
Short. 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 Short.
Okay. Now we're going to move to your legs, and you're going to tell me if you feel soft, dull, or sharp. Can you move your hands for me?
Soft.
or sharp?
Sharp. Sharp.
Soft, dull, or sharp?
Dull. 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 Dull.
Now I'm going to want you to hold out your hands, and I'm going to place something in your hand. I want you to tell me what it is with your eyes closed.
Pen.
Good. Okay. Now I want you to close your eyes and face your palms up, and I'm going to draw a letter in your hand, and you're going to tell me what the letter is.
A.
Very good. Now I'm going to draw a number in this hand. You're going to tell me what this number is.
8.
Very good. Okay, you can open your eyes. The next thing I need to do is I need you to stand up for me. I want you to put your legs together and your arms next to each other, and I want you to close your eyes. And I'm looking for swaying, excessive swaying. Good. Next, I'm going to get you to walk from here to the cabinet, and I'm going to check your gait. Great. And walk back for me. Great. Now have a seat for me. I'm going to check your reflexes. So the first one I'm going to check is your tricep. If you will just relax your arm for me. Okay. I'm going to check your bicep. Put your arm, bend it for me right here. Good. And then your brachioradialis. Okay. On this side. Good. Just relax your arm for me. Just place it. Good. And same thing for this side. Remove your bracelets. Good. Okay. Now I'm going to check your patellar reflex. If you'll just make sure that your legs are all relaxed. Good. And on this side. Oh, good. Okay, I'm going to slide off your shoes. Okay, now I'm going to check your Achilles reflex. And just relax. Good. Now if you will raise your leg for me. Check your plantar reflex. Okay, and this side too. Good. Now, if you'll just relax your legs, I'm going to check for some clonus. So all I'm going to do is raise your foot. I'm going to dorsiflex and plantar flex a few times, and I'm looking for some extra beats in there. Good. Good. Then we have one more thing that I didn't check, your abdominal reflexes. So if you'll just lean back for me and relax. In a clinic setting, I would have you raise your shirt, but for these purposes, I'm not. So I'm going to be checking your abdomen in 4 different places. Good. Okay, do you have any questions?
No questions.
Okay, thank you for letting me do my assessment.